Good afternoon, and thank you for joining the daily briefing on the City of Philadelphia's response to COVID-19. Today, all of our speakers are joining the briefing virtually to adhere to social distancing guidelines. We will begin our briefing today with opening remarks from Mayor Jim Kenney. Mayor, you now have the floor.
Thank you very much. Good afternoon, everyone. And I want to start the week by making sure that all Philadelphia residents know about a new resource to help some of those who are struggling financially because of COVID. The State Department of Human Services today is opening a new emergency cash assistance program for families with children who are working and experience the loss of a job or income. Families that qualify will be able to get an approximately $400 to $1,200 one-time grant based on their family size. This emergency help is available now if you are someone who has had trouble applying for unemployment, or if you are waiting for your unemployment check to come through. Your family may be eligible if your income is below 150% of the federal poverty level, which, for example, is about $2,700 a month for a family of 3. Too many Philadelphians struggle to keep afloat financially, even in normal times, and this virus simply cannot be allowed to become a terrible tipping point that leaves people hungry or without shelter. The state program is limited both in size and duration, but I am certain that every bit of assistance can make a huge difference. The program will only be open for a short period of time. So we're urging Philadelphia families who have lost income to apply to get this extra help. And we ask the media to help spread the word. Apply online at www.compass, that's compass.state.pa.us. That's www.compass.state.pa.us. And I want to talk about aid of a different sort, federal aid to cities like Philadelphia that have been hard hit by direct COVID-related expenses and by the economic downturn. Today, we sent a letter to our congressional delegation about our needs in the next aid package. Among other things, our letter stresses how important it is that future aid packages include funds direct to cities and give those cities flexibility in the use of those funds. Our letter makes clear that without these interventions, local governments will be forced to make drastic cuts, which will deprive residents of needed services. Such cuts would only exacerbate the damage being done to local economies and lessen the possibility of a speedy economic recovery. The letter also urges Congress to focus funding on several priorities, such as the city's need to purchase personal protective equipment and supplies, housing resources for renters and homeowners, and funding to support our most vulnerable residents. We also request additional congressional action to ensure that critical federal safety net programs can continue to provide essential health care coverage, food aid, and income to those in need. And our letter makes clear that additional financial support is urgently needed for our education systems to stabilize the impact and close the gap in learning due to schools and institutions of higher education being physically closed. As I state in the letter, cities and states cannot effectively address and recover from this pandemic without a robust federal partnership and response. And while I'm grateful and appreciative of all that has been done so far, much more is needed to ensure that Philadelphians can safely survive the crisis and thrive beyond it. We know that unprecedented job losses have placed financial pressure on both renters and landlords. That is why on Friday, we announced the COVID-19 Emergency Rental Assistance Program. This program will make rent payments for people who have lost income because of COVID-19 and is expected to keep at least 3,000 families in their homes. Renters may begin submitting applications tomorrow, Tuesday, May 12th at 10 a.m., and they are due this Saturday, May 16th by 5 p.m. Renters who do not have access to the internet or a smartphone will be able to get program and application information by calling 311. To be eligible, renters must have an apartment or house in Philadelphia, have a valid and current written lease signed by the landlord, and have lost income because of COVID-19. Renters do not have to be diagnosed with COVID-19 to be eligible. For more information and eligibility requirements, visit phlrentassist.org. That's phlrentassist.org. Individuals and corporations are also able to make tax-deductible donations to the COVID-19 Emergency Rental Assistance Program through the same website. We have seen deep and heartfelt generosity during this time from people across our city. And this is another great way that Philadelphians can help their neighbors in this time of need. And now I turn it over to Dr. Farley for his daily update.
Thank you very much, Mayor. The COVID epidemic here in Philadelphia is still here. but we are clearly making progress. Since this time yesterday, we've confirmed 102 new cases of the infection in Philadelphia residents, bringing us to a total of 18,313. Now, that 102 number is a very small number, but we received a smaller number of laboratory reports over the weekend, and so we would expect that number to rise a little bit in the coming days. Still, the trend in the number of cases per day is clearly downward, and it may be picking up speed and going down, which is a very good thing. We're seeing also progress in fighting the infection in congregate settings, such as nursing homes. We do feel we're seeing a decline in the number of new cases in nursing homes. And our cluster in the city's jail is now down to where we have 12 inmates with current infection, which is the lowest number we've had in weeks. As far as deaths, we have 0 new confirmed deaths from this time yesterday, bringing us to a total of 893 deaths since the beginning of the epidemic. Now, that's 893 is one fewer than we reported yesterday. There was one yesterday that was an error, and so that's been removed from the total. Now, that 0 is a good number, but also just remember that if we get fewer test results, then we have fewer people who are confirmed as having died from the coronavirus infection. So we would expect to have more deaths reported to us in the coming days. Overall, of the 893 total deaths, 474 or 53% are nursing home residents. Now, for those of you who are following our numbers closely, you may notice that some of them change slightly, such as the number of deaths I reported here. I thought I might take just a minute to explain that. Each day, we get data from a number of different digital data streams. And our staff work very hard each day to assemble all of those and put it together into an overall number which report to the reporters and to the general public of Philadelphia. Later, we go back and double check those numbers, and we frequently find small errors. You may find one person who's been reported through 2 different data streams. We might find a person who was reported as a Philadelphia resident, who in fact is a resident of another county, and so that would be reclassified outside of Philadelphia. Or we may learn of Philadelphia residents who were reported elsewhere who now are counted among ours. And so when we clean those data, the numbers that we report are going to change slightly. So that if you're wondering why they change slightly, that's why. Overall, though, the trend in deaths is downward in parallel with the trend in the total number of cases and in the trend in the cases in congregate settings. We're similarly seeing good news in our hospital inpatients. This morning in Philadelphia hospitals, we reported 822 coronavirus infection staying in the hospital. And in the Southeast Pennsylvania region, the number was 1,495. That number is about 20% below where we were at the peak of the epidemic, clearly going in a downward direction. As far as testing, we continue to add new testing sites. We have more than 40 in the city of Philadelphia, more than 60 in the Philadelphia region. Most of these sites are asking people to call for an appointment in advance. Our website has information on all of these sites with the phone numbers for people to call in advance for those sites. The website, again, for people interested in that is www.phila.gov/COVID. Now, there's one in particular I want to point out. There's a site operated by my department, the health department, in Center City, Philadelphia, which is available 7 days per week. And anyone can come to the site free of charge. All they need to do is call ahead for an appointment and a referral. The number is 267-491-5870. That's 267-491-5870. And anyone meeting our criteria, which these days is people at any age with symptoms typical of the coronavirus infection, can go in there and get a test. Now, overall, there are too many cases for us to say that we can safely restart our activities, but there's clear signs we're making progress against this epidemic. Our actions are clearly slowing the spread. I can't put a date on when our activities can safely restart, but we can start to prepare for that date by thinking about the things we're going to need to do once we do restart in order to keep ourselves safe. And it gets down to 3 things. Number 1, wearing a mask. So everybody's going to need to get used to wearing a mask. Number 2, keeping your distance from other people. And number 3, washing your hands. Now, before I finish, let me just make an important point about voting. The 2020 Pennsylvania primary is on June 2nd. That's coming up. The health of our democracy is very important to the health of our residents. So I want to encourage everyone to vote, but when everyone votes, I want them to vote safely. Now we're working with the city commissioners to have the polling sites be as safe as possible. But the safest way to vote is to vote by mail. And anyone now can vote by mail, but you simply need to apply in advance to get that ballot. And you can apply up until May 26th by going to this website, apps.philadelphiavotes.com. That's apps.philadelphiavotes, one word, .com, apps.philadelphiavotes.com. And you go in there and you can apply. I just did it. And they'll send you a ballot. And you can mail it in. That way you don't need to go to the poll in order to vote. More information on the coronavirus epidemic in Philadelphia, again, is at phila.gov/COVID. Or if you have medical questions, call 1-800-722-7112. Thanks.
Thank you, Dr. Farley. We are now going to move to Armando for the Spanish language translation of both the mayor and Dr. Farley's remarks.
Mensaje del alcalde Jim Kenney para el lunes 11 de mayo del 2020. Buenas tardes a todos. Quiero comenzar la semana asegurándome que todos los residentes de Filadelfia sepan sobre un nuevo recurso de ayuda para las personas que tienen dificultades financieras debido al COVID-19. El Departamento de Servicios Humanos del Estado ha abierto hoy un nuevo programa de asistencia financiera de emergencia para familias con niños que se encontraban trabajando y perdieron sus trabajos o fuentes de ingreso por la pandemia. Las familias que son elegibles pueden obtener una subvención única de aproximadamente $400 a $1,200 según el tamaño de su familia. Esta ayuda de emergencia está disponible desde el mismo momento si usted es alguien que ha tenido problemas para solicitar el beneficio del desempleo o si está esperando a que le llegue este beneficio. Su familia puede ser elegible si sus ingresos están por debajo del 150% del nivel federal de pobreza, que por ejemplo es de aproximadamente $2,700 mensuales para una familia de 3 personas. Hay muchos habitantes de Filadelfia que luchan por mantenerse a flote financieramente, y este virus no puede convertirse en un terrible punto de inflexión que deje a las personas con hambre o sin hogar. Este programa estatal es limitado, tanto en el tamaño como en su duración, pero estoy seguro que cada ayuda puede marcar una gran diferencia. El programa solo estará abierto por un corto tiempo. Por lo tanto, les instamos a las familias de Filadelfia que han perdido sus ingresos a solicitar esta ayuda adicional. Y le pedimos a los medios de comunicación que ayuden a correr la voz. Para solicitar esta ayuda en línea, usted puede visitar www.compass.state.pa.us. Y ahora les quiero hablar sobre otro tipo diferente de ayuda. La ayuda federal a ciudades como Filadelfia, que han sido duramente afectadas por los gastos directos relacionados con el COVID-19 y por la recesión económica subsiguiente. Hoy le envié una carta a nuestra delegación en el Congreso sobre las necesidades de la ciudad para el próximo paquete de ayuda federal. Entre otras cosas, mi carta destaca lo importante que es que los futuros paquetes de ayuda incluyan fondos directos a las ciudades y les den flexibilidad en el uso de estos fondos. Mi carta deja en claro que sin estas ayudas, los gobiernos locales se verán obligados a hacer recortes drásticos, lo que privará a sus residentes de los servicios necesarios. Tales recortes solo aumentarían el daño que ya se está haciendo a las economías locales y disminuirían la capacidad de poder tener una pronta recuperación económica. La carta también le insta al Congreso a concentrar los fondos en varias prioridades, como la necesidad de la ciudad de comprar equipos y suministros de protección personal, los recursos de vivienda para inquilinos y propietarios de viviendas y los fondos para apoyar a nuestros residentes más vulnerables. También le solicitamos acción adicional al Congreso para que garantice que los programas críticos de redes de seguridad federal puedan continuar brindando cobertura de atención médica esencial, ayuda alimentaria e ingresos para los necesitados. Y nuestra carta deja en claro que se necesita urgentemente apoyo financiero adicional para nuestros sistemas educativos, para estabilizar el impacto y cerrar la brecha en el aprendizaje, debido a que las escuelas e instituciones de educación superior están físicamente cerradas. Como indico en la carta, las ciudades y los estados no pueden enfrentar esta crisis y recuperarse efectivamente de esta pandemia sin una sola asociación y respuesta federal. Si bien estoy agradecido y aprecio todo lo que se ha hecho hasta ahora, se necesita mucho más para garantizar que los habitantes de Filadelfia puedan sobrevivir con seguridad a esta crisis y prosperar más allá de ella. Sabemos que la pérdida de empleo sin precedente ha ejercido una presión financiera tanto en inquilinos como en propietarios. Por eso, el viernes anunciamos el programa de ayuda de emergencia para inquilinos durante el COVID-19. Este programa realizará pagos de alquiler para personas que hayan perdido sus ingresos debido al COVID-19 y se espera que mantenga al menos a 3,000 familias en sus hogares. Los inquilinos pueden comenzar a enviar sus solicitudes mañana martes 12 de mayo desde las 10 de la mañana y el periodo de solicitud concluye este sábado 16 de marzo a las 5 de la tarde. Las personas que no tengan acceso a la Internet o un teléfono inteligente podrán obtener información sobre el programa y la solicitud llamando al 311. Para ser elegible, los inquilinos deben alquilar un departamento o casa en Filadelfia, tener un contrato de alquiler válido y actual firmado por el propietario y haber perdido sus ingresos debido a la crisis provocada por la pandemia del COVID-19. Los inquilinos no tienen que haber sido diagnosticados con el COVID-19 para ser elegibles. Para obtener más información y requisitos de elegibilidad en español, por favor visite usted la página web PHL Rent Assist español.org, PHLRENTASSISTESPANOL.org. Los individuos y las empresas también pueden hacer donaciones deductibles de impuestos al programa de ayuda de emergencia para inquilinos durante el COVID-19 a través del mismo sitio web. Hemos visto mucha generosidad durante estos momentos y esta es otra gran manera en que los habitantes de Filadelfia pueden ayudar a sus vecinos en este momento de necesidad. Y de antemano, muchas gracias. Y esta es la actualización en materia de salud al día lunes 11 de mayo del 2020. Desde ayer se han confirmado 102 nuevos casos del coronavirus en Filadelfia. Actualmente tenemos un total de 18.313 casos en la ciudad. Hay algunos laboratorios que no envían sus informes durante el fin de semana. Sin embargo, podemos ver que hay una clara tendencia a la disminución de los casos. Reportamos un avance en la evolución de los casos en entornos congregados. Hay disminución de los casos en los hogares de ancianos. En las cárceles actualmente tenemos 12 casos confirmados, que es el número más bajo en varias semanas. Hoy no reportamos felizmente ninguna muerte por el COVID-19 en la ciudad. Hay un total de 893 personas que han muerto por el COVID-19. 474 o el 53% de estas muertes han sido en hogares de ancianos. Y anteriormente habíamos incluido por error una persona entre los fallecidos del COVID-19. El número total de fallecidos es de 893. Ahora quisiera señalar que recibimos datos de muchas fuentes digitales. Nuestro trabajo consta en verificarlas y en corregir la información si es necesario. Muchas veces la información está duplicada, no cuenta con jurisdicción o lugar de origen y nos toca muchas veces reclasificarla. Los números están cambiando ligeramente. Hay que recordar que este virus no discrimina por raza o por género. 822 personas han sido hospitalizadas en Filadelfia y 1.495 personas en la región sureste de Pensilvania. Estas cifras nos demuestran un claro descenso. Estamos un 20% por debajo del número más alto de pacientes hospitalizados. Las pruebas siguen disponibles con cita previa. Para más información como direcciones o los números de teléfono de los centros de prueba, por favor revisar el sitio web fila.gov/COVID-19, pestaña FAQ. Hay 40 centros de prueba en la ciudad de Filadelfia y 60 en la región. Los datos nos muestran que vamos en la dirección correcta. Nuestras conductas están deteniendo la propagación del virus, pero aún hay muchos casos como para abrir la ciudad nuevamente. No podemos ponerle una fecha en la cual las actividades se reanudarán de forma segura, pero podemos prepararnos desde ahora para ello. Acostumbrémonos a usar una máscara al salir, a mantener la distancia social y a lavarnos las manos frecuentemente. Y recuerda, mi máscara te protege a ti, tu máscara me protege a mí. Antes de despedirme, quisiera hablarles sobre las votaciones del 2 de junio. Las primarias del 2020 están planificadas para realizarse ese día. La salud de nuestra democracia es tan importante como la salud de nuestros residentes. Les alentamos a todos a votar de forma segura. Estamos trabajando con los comisionados de la ciudad para hacer los centros de votación lugares más seguros. Recuerde usted que también puede votar por correo. La fecha límite para solicitar una boleta de votación por correo es el día 26 de mayo y se puede hacer en appsphiladelphiavotes.com. Juntos podemos y lograremos superar este gran reto. Gracias.
Thank you, Armando. We will now move to our Q&A portion for members of the media. We do have limited time during these briefings, so only one representative from each media outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer, and we will do a second round of questions if time permits. For those logged in today, please use the raise your hand feature, which can be found under participants. We also ask that you use video to ask your questions if you are able for broadcasting purposes. We will now unmute reporters one by one to ask your questions, starting with Jeff Cole of Fox 29. Jeff.
Yeah, I want to start questions for both Dr. Farley and Mayor Kenny. Dr. Farley, on Friday, a spokesperson in the mayor's office said that city leadership believes that a regional plan tailored to our population density and other factors is appropriate, and we look forward to announcing it. A regional plan in terms of opening Philadelphia. And he indicated that you are having discussions with Dr. Levine and the governor's office about this. You tell us details of your discussions about a tailored plan to reopen Philadelphia and maybe the region.
I'm afraid we don't have any details we can share with you right now. I'd simply say we're engaged in discussions. Philadelphia is clearly different from a rural county that has few population and even fewer cases. And so we want to have a plan that makes sense where we can open this hard-hit city in a way that is nonetheless safe. And so there are discussions taking place. There's nothing close to being announced yet. When we get close, we'll let you know.
Do you think that the city is close to opening in yellow? Do you see a date coming up for the city to move into yellow?
I can't put a date on that now. Again, we're still seeing hundreds of cases per day. The epidemic is still here. There's plenty of cases in the city. So we're not safe yet. And I can't predict when we will be because I can't predict the future of how this case counts are going to go.
I could a question for Mayor Kenny, if I could.
Yeah.
Mayor, do you think the governor's standard for cities like Philadelphia with our density and poverty level and nursing home population simply doesn't take into account the specific challenges that you have in the city that you're trying to lead, and that there needs to be a more aggressive program that looks at how Philadelphia can open and not sometime well into the summer?
I the opposite. I think the governor's been very cooperative and amenable and discussionary with all of us in the region. There's nothing worse than jumping the gun and wind up opening up too soon and then falling back with a surge that will kill more people and take us longer to recover. So we're working together with Montgomery County, Delaware County, Bucks, Chester to have these discussions. And we also have to take into account what happens in New Jersey because it's such close proximity over the bridges. So I have no complaints about the governor, and we'll continue. There's no playbook for this. This is not like you can go back and look at a game film and know what exactly to do. But I trust the medical advice. I trust the scientific advice, and we're just going to have to take it day by day.
Have they given you an answer as to when they're thinking they might be able to help you out a little bit? Anything ballpark?
Help me out with. Could you define help me out?
Moving to yellow. I mean, do they even given you?
We're going to move to yellow when it's safe. And when it's safe is when the guy in the third screen tells me where we're going to move to yellow now. That's the health minister.
Could it be the
I don't
end
know,
of July?
Jeff, you're asking for dates I can't give you. We're getting better. The cases are going down. There's less people dying, but I don't want to go back to a high level of death and sickness because we moved too soon.
Thank you.
Thank you, Jeff. We're going to go to Mitch Blocker of NBC 10.
Thank you, Dr. Farley. You've said you'd like to have at least 5,000 tests performed a day. I'm curious, how close are we to that goal in Philadelphia?
We're ways off now. We're about 1,500 tests per day, and we're still, while we're expanding the number of sites, we're increasing the number of people who are tested. We're still periodically bumping into problems where we can't get testing supplies, and there still is limited laboratory capacity. So we still have a ways to go.
How are we doing with wearing masks?
I don't have statistics on it. I feel like I see more people wearing masks. We are hoping we might be able to get some statistics in the future. I think people, just based on what I'm seeing, we need to do better.
And one last thing, every day you have updated hospital capacity in the region. How close did we come to filling up hospitals at our peak?
We did not come very close to filling up the entire region. However, it was clear that some hospitals were at their peak. They have what they call surge space. That's beds which are not used in ordinary circumstances, which they open up when they're full. So there were a number of hospitals that opened up surge space. And there were hospitals, as I said, that had to transfer patients to other hospitals because they were full. So the system came under strain, no question about it. We didn't come close to filling the entire capacity, but we don't want to get that close again.
Thank you, sir.
Thanks, Mitch. We're going to go to Walter Perez of 6 ABC.
Hi, Mayor.
Yes.
Two quick questions. One is just kind of dovetailing off what Jeff was saying. Just reaction to Philadelphia receiving the second lowest number of business waivers to reopen in the 5-county area, second only to Delaware County, and Montgomery County receiving pretty much double the number of waivers as compared to Philadelphia.
Yeah, I mean, I haven't looked at the numbers. I think Brian, do you know, or Doc, do you have any insight into why our numbers are lower?
No, we haven't been able to do a full analysis of that yet.
Okay.
The answer is I don't know. We'll find out.
That's fine. And Mayor, the second question, we've gotten some notifications from business owners with concerns about the closure of Walnut Street by 13th. They say that they received no warning, no notification when it happened a few weeks ago. Any information about that?
I think that had to do with the hotel, Brian.
Yeah, it did have to do with the Holiday Inn Express and the activities that are happening on the street. Given that we are at a stay-at-home order, I'm not sure what businesses were concerned and what the impact was on those businesses. We are working to see whether those operations will need to be maintained in their current state or not. But I think we were acting quickly to do what we needed to do to make sure that site was operationalized.
Is there any time frame in terms of how long you think it might remain that way?
I think we are looking at whether Walnut Street needs to remain closed, and certainly we'll take the businesses into consideration. But again, we need to make sure that that site stays operational in order to make sure that our residents are protected.
Okay, thank you.
Yep.
Thank you, Walter. We're going to go to Sean Walsh of the Inquirer now.
Thank you. Mayor, this is similar but different to the other questions about reopening. Some county officials and businesses have floated the idea of reopening or moving to the yellow phase before the governor approves it. What would be the impact on Philadelphia if one of the collar counties partially reopened before the city did?
I don't expect them to do that, considering the conversations we've been having with them. I don't know if you saw the governor's press release this morning relative to the 3 counties threatening to open without permission. They're pretty stern language and pretty stern reactions coming from the governor. And I don't know whether or not these county officials want to enter into that fray. That's certainly their decision. I would hope they would follow the governor and the health secretary's advice. I understand the people's desire to have this over with. There's no one wants this over with more than us, but it will never be over if we don't do it the right way and the safe and healthy way. You see in Georgia and Florida, people seeing surges again in those areas. And I just don't want to go back to early March again.
Okay, thanks. And then probably for Brian, could you give us an update on the number of people staying at the Holiday Inn and the other facilities the city is using?
Sure. Let me get the number of folks at the Holiday Inn is 107. And I believe we have 5 at the Fairfield. We are, I think I mentioned this last week, we are looking at our protocols, and we'll continue to look to increasing that census to get as many vulnerable people out of our congregate care facilities as we can.
So for the 107 at the Holiday Inn now, do you have a breakdown of if they're homeless people or medical workers, or who exactly is in there?
The majority of the population at the facility are those that are unsheltered in one form or another.
Okay, thanks. And then lastly, Mayor, Wednesday is the 35th anniversary of the Move bombing. Former Mayor Wilson Goode is calling for an official city apology for that incident. What are your thoughts on how the anniversary should be?
Well, before I give you the answer, I fail to see the connection between COVID-19 pandemic and that question, but as it may, we have no plans at this moment to do so. If you read Mayor Goode's letter, he apologized in 1985, and that's already been done. I think the most important thing about this issue is our administration's response to rebuilding that neighborhood. From 1986 on, there was a series of debacles when it came to redoing those houses. We are almost done now in renovating the homes on the 6,200 blocks of Pine and Osage, and it's been privately financed. There are new families living in those homes, and we expect as construction loosens up, we'll have the remainder of them done, and that's the real way to kind of address the problems of the past, is by making that neighborhood whole again.
Thanks.
Okay, thank you, Sean. We will now go to Michael Fletcher with ESPN.
Yeah, thank you so much. And Mr. Mayor, there have been numerous reports that Major League Baseball is moving to start its season perhaps as soon as July. And one of the plans would involve playing games in home ballparks without fans. I'm curious about, what you've heard from Major League Baseball, from the Phillies organization, or even from the governor's office about such a plan.
We haven't had any direct conversation about the plan. It's certainly up to them to determine how to safely do this. The Middletons and the other owners of the team have been great corporate citizens. I'm sure they'll take into consideration the safety of their players and staff there. Frankly, personally, I would love to watch a baseball game, even from my couch. It is just TV has been hard. You're stuck in the house and watching reruns of Law and Order for the third time are getting old. So I would love to watch a baseball game, even if there's not a fan in the stands. But we have no idea exactly when they're doing this or if they're doing this. But if we could do it safely, I'd certainly welcome a ball game.
What would you like to see in place for you to sort of see this as a good idea? I heard it just mentioned that you guys would love to have 5,000 tests a day, for example, but right now you're testing maybe 1,500 people.
Right.
What level of testing would you like to see in place for baseball? And even if they had the resources for testing, would it be appropriate to use like the number of tests they would need just to have baseball games? That would be a Dr. Farley question. Dr. Farley?
So, we have not talked directly to the Phillies or any other baseball team about what their plans are. I would be hopeful that there's some sort of plan that could do this safely, and testing may be part of that. But I think we need to have a lot more detailed discussions with them about how to do this safely.
Michael, did you have an additional question?
Looks like he's frozen the screen.
I think the screen froze a bit. All right, Michael, we'll move on. But if you do have another question, just raise your hand again. We're going to go to Megan Walsh of Temple Update now.
Hello, this question is for Dr. Farley. So there's been a lot of concerns about the inflammatory disease that's been seen in New York City. Have any Philadelphia hospitals recorded these cases? And could this syndrome impact children's going back to school in the fall, do you think?
So their pediatricians are very interested in this issue. And I can tell you that there are approximately 6 patients that possibly have this syndrome that are being looked at our 2 children's hospitals in the city. Because we don't know much about the syndrome, we don't even have a name for it yet. We don't know exactly how to define it. I can't give you a hard number on it. I can tell you that there's a lot of interest. It does appear to be that there's some sort of problem related to the coronavirus infection. Much has to be defined in the future. And how extensive this is to be defined in the future. Now, in the past, we've thought that this infection really didn't occur in children, or if it did, it was so mild it was unimportant. This is maybe a rare, but certainly serious and important complication of it that'll help us rethink a little more about this infection in children.
And what do you think would happen in the fall? Like, would this impact going back to school for children, like separate from the coronavirus itself, or?
Yeah, good question, but it's really just too early to say. We're just really starting to learn now about this complication.
Thank you.
Thank you, Megan. We are going to move to Natasha Brown with CBS 3.
Hi, this is just a question for Mayor Kinney or possibly Dr. Farley as well. We know that City Council President Darrell Clark was out on Friday giving out masks. We know how serious you've been, Mayor Kinney, just about making sure that residents have masks and stay masked up in a sense. Wondering if there's going to be a bigger citywide effort to distribute masks to residents, or just to make sure that folks are getting the masks they need and that they're wearing them.
We again would like everyone to wear one. They're not that complicated device to put on. They're not that uncomfortable, especially the cloth masks. We have really great efforts that we've been doing to get PPE into the hands of congregate care folks, homeless shelters, and the hospitals. So I'm not sure we're going to be able to get to the point where we're handing out a mask to everyone. If we have large amount of cloth masks, I would rather see them distributed maybe on a SEPTA vehicle, subway or bus. I think that makes the most sense. There's been other ideas bandied about as far as branding and design that people would be interested in wearing because they look good or they're associated with one of the sports teams. So I don't have a full answer for you, but we're doing our best to get the word out, and whatever we have in addition, we can begin to distribute.
And also, Mayor Kinney, just one other thing, just in reference to this past weekend, especially even in the midst of this pandemic, we're still dealing with lots of crime here in the city. It's been a pretty violent Mother's Day weekend. So we're just wanting to.
Lots of shootings, too many guns, and we were doing our best to work with our partners in the community, which has made it more difficult because of COVID. The number of people that are addressing us on the street was fluctuating because people were worried about being ill. Part of the effort with these young men generally are to try to find them work, which is obviously very difficult to do now that everybody's on. We're just going to keep on plugging away at it as best we can, and I wish people would put aside their beefs, put aside their anger towards each other, keep our intensive care beds open, and do something right for your family and friends and your neighborhood by just putting the guns down and stopping. In the meantime, we'll continue to arrest people that are violating or carrying a gun. Obviously, anybody shoots anyone or kills somebody, we're going to arrest them. But I'm sometimes at my wit's end with this because it seems like the time when people would kind of put their beefs aside. But we'll keep working at it.
All right, thank you very much.
Thanks, Natasha. We're going to go to Avi Wolfman-Arent with WHYY.
Hi, this question is for Dr. Farley. I'm hoping you can do some number translation for me. One of the milestones we hear about across the country and the world is getting to an R of 1 or lower in terms of transmission. With these numbers that you're putting out today, do we know how close we are in Philadelphia to an R of 1 or lower?
Yeah, well, I just know this much. If R is greater than 1, then the number of cases we see each day after you take into account the fluctuations will rise. If the R is less than 1, then the number of cases each day will fall. The number of cases we're seeing each day is falling over time. So we know that R is less than 1. I don't know how to calculate it exactly. I think we're going to have to do some mathematical modelers to come up with that. It's definitely below 1. That's a good thing. If we can keep it below 1, then eventually this virus goes down to 0. Keeping it below 1 is hard, though. We need to keep it up.
And one more thing. I know we're a ways off from the next school year beginning, but I'm curious if there are any numerical milestones or other types of markers you would look for in order to determine whether it's safe to have some form of in-person classes.
I think school is going to be one of the harder things to open because there's a lot of people in a closed-in space. So we're not there yet. I'm thinking about what kind of measures would make us feel it was safe to open school. We're still trying to figure out what kind of measures would make it be safe for us to take even the first step.
Thanks.
Thank you, Avi. We are going to go to Martin Pratt of Philly YBN.
Yes, this question is for probably Brian. The cultural office that was shut down, is there a possibility when it comes to what I'm hearing from a lot of grassroots art organizations is that there seems to be a disconnect from understanding why the budget removal of the entire office was necessary, since a lot of the funding comes from federal. But I also wanted to ask, is there, I think I asked this before of the mayor, and I wanted to find out from you, is there an appetite for a private funding option when it comes to the arts? And what would it look like if the city was not necessarily behind it, but was embracive of that?
Sure. So I think that's a great question, Martin. And so and the way we're thinking about the Office of Arts, Culture, and the Creative Economy is in a similar vein to what you suggested. And so while the office may have closed, there are some resources that we are retaining, specifically staff resources that will report into the managing director's office to do exactly that, to try and work with both private and federal resources to support our arts community. I think we recognize the importance of the arts to Philadelphia. want to make sure that we are aligning our resources to the best of our ability, and hope that the staff that we are retaining can certainly do that as we go forward.
So that would be, if any of our organization wanted to reach out, they would need to reach out to who now? What organization?
So we will retain staff from the Office of Arts, Culture, and the Creative Economy. That staff will report at the Managing Director's office, and just stay. I think I'd say stay tuned, and we can make it more clear of exactly who that staff is as we go through our realignment process here.
So it's not going under the Commerce Department?
No.
Okay, gotcha.
Creative Economy will go under the Managing Director's office.
Gotcha, excellent. And this question is for Dr. Farley. There has been recently, the last week or so, I believe, people coming to ER rooms in New York, and I also believe it was Detroit, with very low oxygen levels in their blood. And doctors, instead of putting them on ventilators, have been using CPAP machines. How, to your knowledge, has that happened in Philadelphia, where typically people who have low oxygen in their blood are usually unable to talk, or they're unconscious? They haven't presented any of that. Even though they have very low oxygen in their blood, they're talking, they're smiling. And the doctor said, instead of putting them on ventilators, they've been using CPAP machines in those specific situations.
Yeah, I've not heard of anything specific that's happened in Philadelphia right now, but I wouldn't necessarily. I have read about this one thing that's unusual of this infection is that people can have very low oxygen levels and not have much in the way of symptoms. And so there may be steps that they can take short of putting these people on a ventilator, which would be better because they're less intrusive. I can tell you, though, that the doctors in the city are very aware of these various options of what they can do to avoid putting people on a ventilator. One thing is putting someone prone so that they're lying on their stomach rather than on their back. They can breathe much better that way. And that step alone can help some people be on a ventilator. I'm sure many of them are trying CPAP as well, but I don't know of any specifics that's happening recently.
Thank you. That's all.
Thank you, Martin. We're going to go to Michaela Winberg with Billy Penn.
Hi, everyone. Quick question for the mayor, sort of a follow-up to Sean's question earlier. I know council has been concentrating on budget and coronavirus-related work, but some council members, like Councilmember Gautier, reportedly plan to introduce a resolution for the city's formal move apology. Would you support that at this time?
I'm not in a position to support that. That is council's activity. Council passes resolutions. I do not sign resolutions. I only sign bills. So council, through the resolution process, can give a sense of what it is they want to say, and it's their right to do that, and I have no quarrel with it. But we have no plans to formally apologize again to anyone, other than trying to get the neighborhood back together, secure, and those houses that were disgracefully redone, renovated, and built, get them stable and make sure the neighborhood is back to as much as possible. So council's free to do what they want, and I'm not complaining to them, but I'm not participating.
Got it. Thank you. That's all.
Okay. Seeing no further questions at this time, we will conclude today's daily briefing, and we will be back here tomorrow at 1 p.m. Thank you all.